Welcome to Hello Doctor Talks. Today we are going to discuss about HPV vaccine. To discuss more on this, today with us Dr. Sahithi. Dr. Sahithi, consultant obstetrician and gynecologist and laparoscopy surgeon from Kim's Cuddles Hospital, Hyderabad. Doctor, what is HPV vaccine?
HPV vaccine is a vaccine given for human papillomavirus infection. So this human papillomavirus infection is one of the most common infection which is transmitted sexually among the Indian population, and few strains of this vaccine can cause something known as cervical cancer. Now, what is cervical cancer? Cervix is a part of the uterus, that is the womb. The mouth of the womb is known as cervix, and the cancer of this area is known as cervical cancer, which is the second most common cancer in the Indian women. So this vaccination prevents cancer. That is why this is recommended.
Doctor, what is it recommended in and what is dosing schedule?
Ideally, the vaccine has to be given in girls and boys aged between 9 and 14 years. That is when it is 99% efficacious. But if somebody has missed the vaccine, it can be given up to the age of 26 years. Now, when this vaccine is given in children between 9 to 14 years, only 2 doses are sufficient. That is, one first 0 dose and the second dose after 6 months. But if it is being given afterwards, it has to be given as 3 doses. That is 0 dose at the second month and at 6 months.
Doctor, is HPV vaccine safe?
This vaccine is absolutely safe. It has been recommended by the Center for Disease Control, WHO, Indian Academy of Pediatrics and the FDA of the USA.
Doctor, if patient taken the vaccine, is there any chance of getting cancer again?
So this vaccine prevents cancer caused by certain strains of the virus. But the research is still going on that there are other strains which can cause cancer. Hence, even if you've taken the vaccination, it is very essential that you get the screening procedure done by a gynecologist once every 3 years after the age of 30 years.
Doctor, what are the precautions to be taken?
Particularly, there are no precautions that need to be taken for this vaccination. Even if the woman is menstruating, she can take this vaccine on any day of the cycle. There is no restriction for that. A breastfeeding woman can also take this vaccine safely.
Doctor, is there any side effects with HPV vaccine?
Like all vaccination given in children, there are some general side effects which are very minor, like fever, which can last for a day, injection site pain and headache and weakness that can be seen, but they generally last for a day, that's all.
Doctor, is it safe for women planning for pregnancy or in a pregnant woman?
This vaccine is not recommended in pregnancy. So vaccine should not be taken in pregnancy, and women who are planning pregnancy, if they have taken vaccine, it is better to avoid pregnancy for at least 3 months after vaccination. Now, if you have conceived accidentally in between the vaccination schedule, then you can continue your pregnancy like all regular pregnant women. But your missed doses, whatever remaining doses are there, they can be taken once your delivery is completed.
If you have still doubts in this topic, kindly mention in the comment box.